An advisory committee to the FDA is meeting right now to discuss boosters for the Johnson & Johnson COVID vaccine. We've got Dr. David Winter from Baylor Scott White Health with us today. Okay, so what are you expecting out of today's meeting?
Yeah, Sonia, I was listening to some of the deliberations this morning. It's interesting, the J&J company is clearly making their case that they should have a second vaccine out for anybody who got the first one. And the debate is about the fact that, well, J&J works pretty well with one vaccine. Do they need a second one? Well, that's the debate ongoing. We'll hear more about that later today. Another big question, though, is if you've had J&J, should you get a different vaccine as a second shot? The example is Great Britain, where AstraZeneca makes a vaccine very similar to J&J, and there they gave either a Pfizer or Moderna shot after the first J&J, and they got higher antibody levels. They're supposed to debate that later this afternoon, so a lot of information to come out in the next coming days.
Yeah, and I've been listening in as well. I mean, I did yesterday. I have to the extent that I've been able to today, and the data they're sharing is pretty promising today, I have to admit. Now, yesterday, the same panel unanimously voted to advise the FDA to authorize Moderna's COVID booster. So what are the next steps here for people who got the original Moderna COVID vaccine?
Yeah, to emphasize what you just said, it's not been approved. Moderna as a booster has not been approved, but the advisory panel is recommending that. The FDA typically follows their advice, but are not compelled to do so. The debate also is, do you need one or not? That's the big question. So more to come with that. But what they recommended actually was that after 6 months after your second Moderna shot, you should get a vaccine. It'll be half a dose, by the way, but these are for people that are age 65 and older, age 18 or older who have underlying medical conditions that might lower your immune response to the virus. Or number 3, you work in an environment where there's maybe lots of COVID spread. For example, healthcare workers, grocery workers, or teachers. Sonia.
So, Dr. Winter, you said something that I do think we should, clarify. It's a half a dose this time for a booster, right? Some people, including one guy who tweeted
Correct.
me, said, hey, I already got the third full dose of Moderna. I'm not sure how some people were able to do that, but what do you say to your patients right now?
Well, to that guy, I would say you got more than you need, but you'll probably do fine. Yeah, we should wait and see what the official recommendation is right now, and it's going to be half a dose if the FDA takes the recommendation of the committee.
Okay, Dr. Winter, I've noticed something, just being out and about, more and more folks not wearing masks in public indoor spaces. I'm usually the only one still wearing mine, to be honest with you. So what are your thoughts on this in terms of risk level, whether you're vaccinated? I'm sure a lot of these people say, look, I'm vaccinated, I should be fine. Or maybe those who are unvaccinated against COVID-19.
Yeah, the CDC's official recommendation is still you should wear a mask indoors if you're in a community where there's a fair amount of COVID-19 going around, if number 2, you have some medical condition that lowers your immunity, or if you've not been vaccinated. Now, I don't have a medical condition that underlies me, and I've been vaccinated, but I wear my mask out there because I don't want to get even a mild case of COVID, Sonia, and have to quarantine, not be able to take care of my patients. And number 2, I don't want to spread this virus. That's the way the virus stays alive, jumping from one person to the next and keeps the pandemic going. So I'm like you, I'm wearing a mask.
Yeah, I can't justify not doing it. No time to get sick. All right, Dr. Winter, thank you so much. Appreciate your time today.